I'm Dr. M.C. Uttappa. I'm the head of interventional radiology at Manipal Hospitals Group in Bangalore. Today, I'd like to share with you a new treatment that we have started at Manipal Hospital in Old Airport Road unit. This is a story of a young lady who is 27 years who came to me with a thyroid nodule, which she had initial investigation done in Chennai. The initial fine needle aspiration cytology showed a benign thyroid nodule within the thyroid gland. However, it measured 5.5 by 4.8 centimeters. This was starting to cause some pressure symptoms, and she was very concerned that it was growing in size. She explored various options, also met a surgeon who offered a surgical treatment for her. On initial assessment, I could see a well defined thyroid nodule. Review of the thyroid FNAC showed a colloid goiter. The thyroid function test showed a euthyroid status with no abnormality. After a careful, detailed discussion with the patient, we decided to offer her a non surgical approach called thyroid ablation using radiofrequency. We conducted the procedure as a daycare procedure, wherein she was admitted in the morning and had the procedure the same day and was able to go home by the same evening. The procedure is done under local anesthesia with minimum sedation under continuous ultrasound guidance. The procedure was undertaken over half an hour as the nodule was 5.5 or 4.8 centimeter. Based on ultrasound assessment during the procedure, we were able to do a complete ablation of the thyroid nodule. And at the end of the procedure, she had no major discomfort after the procedure. She was kept under observation for a few hours in the ward and was sent home with minimum painkillers. So in summary, it is important to understand that benign thyroid nodule is a very common problem seen in many young people. It is slightly more common in young women. The benign thyroid nodule, once diagnosed, can today be treated without a need for surgery, without the need for general anesthesia, without the need for a scar. We are confident that this will greatly benefit many patients in the near future. Thank you.
Hi, I'm Navina, an IT professional from Chennai. So I started noticing a mild swelling with my thyroid 2 years back. Initially, the swelling was very small, so I kind of neglected the whole issue. Over the period of 2 years, the swelling increased, and I kind of met doctors in Chennai. So I was asked to take a lot of tests and scans. So slowly it turned out to be a colloid nodular goiter. And I consulted a lot of doctors in Chennai for the treatment procedures. Typically, the suggestion was that I would have to go for a surgery, which would require removal of my entire right lobe of my thyroid. I was very much apprehensive of the surgery, considering a lot of challenges because of the surgery, also because of losing a part of my thyroid gland, which is a very important gland for the functioning of the body. And if I were to go for a surgery, then I'd be bedridden and I'd not be able to, have a normal life after that. And there's definitely going to be a scar on my neck, so I didn't want any of that. So I was looking for a lot of alternatives and procedures to treat this issue without going for a surgery. And that's when I identified, honestly, it is purely luck to get to know Dr. Uttappa. He's an interventional radiologist who is a specialist in performing radiofrequency ablation. So through this procedure, he recommended that we can ablate the entire thyroid nodule, which is not necessary for the normal functioning of the body. So the whole swelling and the nodule would go away over a period of few weeks and in the subsequent months. So the first time I met Dr. Uttappa was through a video call. It was a video consultation. He was very sweet enough to explain me what the issue is, and where it's coming from and what can be done. And then after a month or so, I met him at Manipal hospitals. So the day I met him, the whole process was really, really smooth, right from registration. It is an online registration or an automated registration. So right from the registration process to consultation process, the whole flow was very smooth and easy. And the appointment with the doctor went very well, where he gave me a lot of confidence, and it was definitely a feeling of what do you say, a big burden that's gone off your head, because of the thyroid nodule, because it was getting bigger and more visible, and the challenges that I had faced because of the nodule, like difficulty in swallowing food, or the nodule being very big, and cosmetic issues where people look at me and ask me, hey, what's wrong with your neck? So after meeting the doctor, I felt really, really relieved that I'm going to finally get a complete recovery from my problem without a surgery, and that's the best part. And the staff here are really courteous, and they're very friendly. They helped me a lot, starting from getting an appointment and meeting the doctor and treating me here, receiving me here really well. So I had the surgery on 16th of December 2021. So I got admitted the previous day. Again, the whole admission process was very smooth, and the way the nurses and the hospital staff treated me was really amazing. So during the surgery, the doctors explained me the whole procedure, what they're going to do and how they're going to do, and they made me feel very relaxed. And then I was taken into the sedation. It was a local anesthesia, so I was almost awake through the entire procedure, and the doctor really encouraged me and made me feel very comfortable throughout the entire 1.5 hours of process. And the surgery was a success. So finally feeling very happy, honestly very thankful and grateful to all the doctors who treated me and guided me throughout this process. So all thanks to Manipal Hospitals and Dr. Uttapa and his team. Thank you very much.